dental implants and bone availability. One of the common questions that is asked to me by patients when they come to get their dental implants done is, do I have enough bone to get dental implants done? How will I know that in the first place? So we will address this question in this particular video. This is Dr. Arun from Pearls Dentistry, running a dental centers at Chennai, Rajanamalapuram since the year 2001. If you have not subscribed to our channel, please do subscribe. We're coming out with a new video every day. So to answer this question, do I have enough bone to get dental implants done? We need to first address what was the primary reasons in which we lost our teeth, what led to the loss of teeth, when it led to what, and when we know that, we will have a basic idea of whether we will have implants, whether we have enough bone to get implants or not. Then once you have lost the teeth, what are the techniques that we usually use to actually measure the bone that is there, which will help us to know about the quality and the quantity of bone, is what then we will look at this video. Generally, if you look at it, patients can lose teeth for most commonly reasons. One is because of decay. The patient could have got a root canal done, could have got failed. So because of the decay, there is extensive damage to the tooth. Then we might have to remove the tooth in that case. This is one of the commonest reasons where we remove teeth. The second commonest reason is patients' teeth become mobile because of gum disease. When it is becoming mobile because of gum disease, the tooth is not held inside the bone. Because they are not held inside the bone, we may not take the tooth out. So that's second commonest reason. The third reason is because of trauma. Some accident, something that happened which has made us lose the teeth because of trauma. So if you look at these three reasons, if you look at it, the reason because losing teeth because of decay, invariably the patients will have some amount of bone that is left, because tooth is otherwise healthy, it is firmly held inside the bone, the tooth is not shaky, so the patient will have usually good amount of bone for them to get dental implants done, because the tooth is already there inside the socket. Of course, if there is an infection because of the decay, it could have led to bone loss, which we will address it as we progress in the video, how we can identify that. The second reason what I told is because of gum disease, the tooth is becoming mobile inside our bone. When there is gum disease, what happens is there is progressive bone loss that happening. The bone that holds the teeth becomes progressively smaller and smaller and smaller in size, which is not able to hold the teeth anymore firmly inside the bone. When it's not being able to hold the teeth firmly, then only you may have to take the tooth out. So in this instance, what we need to understand is, to start with itself, there is less bone to start with. So it is very important when in our mouth, when we know that our tooth is beginning to shake, to go attend to that problem initial stages itself, because when we wait for an advanced stage of tooth mobility, we must have lost a lot of bone because of that. The third component is trauma, where tooth is getting broken. Depending on the trauma, how severe it is, we might have a good bone structure still remaining after the tooth is broken, or the trauma could have made the bone to get also lost because of trauma. So where we need to use some measurements tool to actually measure how much of bone that is there. So these are the different methods by which we have lost teeth, which we can potentially lose teeth, which help us to understand how much of bone that is going to be there for us to get dental implants done. So then, once we have known that, the next step would be actually to clinically examine. So when a patient comes, we actually examine the tooth. We actually clinically see, where we can actually look at the tooth and then we palpate it. We measure certain values that are inside the mouth by using certain tools that we use for diagnosis to actually measure the bone. So that is one component. Of course, then the next aspect is we do a radiographic measurement. So we take X-rays. X-rays will also give us an idea how much of bone that is there. And the best form of diagnosis when it comes to X-rays is taking a CT scan, where we usually take a CBCT or a cone beam CT. In cone beam CT, we actually measure the quality of bone as well as the quantity of bone. Also, we can feed the data into a software, and then in the compute result, we can virtually place an implant to see whether there is enough bone or not. So all these techniques, one is of course knowing how the tooth is lost or how the tooth is going to be removed. Second is doing a clinical examination and doing measuring. Third is doing a radiographic measurement on a CT scan to actually virtually plant the implant will help us to determine how much of bone that is there for us to get dental implants done. I hope we answered this question. If there are any other questions, please do ask in the comment section below. We'll be happy to answer. If you like the video, please do click the like button and do subscribe to our channel. Until next time, this is Dr. Arun from Pearls Dentistry. Bye bye and thank you.